COVID-19 has sped up the evolution of services globally. Many sectors, including food delivery and health, have done very well to see opportunity in chaos and embrace it. Joining me to discuss is Futurist Gihan Perera. Welcome, Gihan.
Well, hi, Jenny. How are you going?
Yeah, really well, thank you. And the changes we're seeing now were inevitable, right? Just kind of sped up by the necessity of the pandemic.
Yeah, that's exactly right. So some of the things that we've seen happening have been happening for a while, but suddenly they become mainstream because we need them now rather than them just being a nice to have. Things like delivery. So, we've had supermarkets doing home delivery for years now, but suddenly it's meant that more and more people have wanted to have their food delivered to their home, either because they're worried about going out or because they just think it's safer for it to happen, or because we've had shutdowns. So suddenly it's become a necessity rather than just a luxury.
Yeah, there were some services before. The pandemic certainly impacted supermarkets to the point initially where they couldn't quite figure out how to get the food to the people fast enough. But now it's become quite efficient, and we're seeing a brand new era of things like online shopping and deliveries, which is just so convenient.
Yeah, and it's affected both sides of this, Jenny. When you look at what customers want now, there are some customers who've never thought about shopping online ever before, and now they've decided to just dip their toe in the water and try it out and find out that actually it's not as bad as they thought. And then there are retailers and other providers who have suddenly realized that they need to scramble and create an online presence, and some of them are doing it well, some of them are not doing it so well. And some of them are partnering with others. So I know that, even in the Barossa Valley, I saw that Barossa Fine Foods, which has had an online shop for a while, has now partnered with some other local providers and allowing them to promote their products on the Barossa Fine Foods website, which I think is a great idea. It's local communities coming together and helping each other with skills that maybe they don't all have, but working together for the benefit of everybody.
And as a futurist, you can probably see what might happen with things like, delivery services becoming more tech savvy, maybe robots getting involved, more drones, things like that.
Yeah, that's happening already, Jenny. So it's interesting that I've been kind of tracking this for a few years now. And just recently, just in the last week or so, Amazon has had drones that have been able to deliver, because they've always been without retail stores, although they've started offering those now as well. But there's always been buy online and we'll have it delivered to you. And they've been experimenting with drones. And just in the last week, they've got approval by the US government to be able to fly their drones. So in the past, they've had the technology, but they haven't had the approval, and also they've had neighbours are worried about you nicking their stuff or somebody else nicking their stuff if it arrives on their doorstep. So it's not the technology that's getting in the way. Now the technology's been there, but it's now society's catching up and saying, yeah, we're willing to try things like drones and delivery robots as well. So I've seen the US Postal Service has been experimenting with having the postie being a robot that delivers your mail. So yeah.
Who's the dog going to attack in that case?
Exactly right. Maybe it'll be a robot dog attacking you.
Futurist Gihan Perera is with me, talking about how the pandemic has sped up a lot of the services that we experience. Telehealth is one of them, and just the health industry generally. Tell us a little bit about this one and how you see it going into the future.
I really like the idea that telehealth has really taken off in Australia. And again, it's happened because of necessity, because people don't want to go and visit their healthcare professionals for everybody's safety and health. And so telehealth is something that's been around for a while. So the idea is that you can have a consultation online. You can do it through Zoom call or through some sort of secure video conferencing service. And that has been around for a while. And even as long as 5 or 10 years ago, their patients were saying, we're happy to get phone consultations, we're happy to do video conferencing, we're happy for our doctor to send us x-rays by email, and then we'll have a little video conference call to have a conversation about it. And so it's not saying we're going to get rid of the health service and go to Dr. Google all the time. It's saying we want We want to work with professionals. We trust our doctors and our other healthcare professionals. But we also want to use technology. And the thing that got in the way was that the government had no way for doctors and other health professionals to be able to bill for that.
Right.
And then suddenly at the start of the pandemic, we realized the fewer people we have moving around, the better. So let's allow the healthcare system and health professionals to use telehealth. And so now that's become part of the system, and it's really going to take off in the future, Jenny. And again, it doesn't mean that people aren't going to go and see their GP, but it means that it opens up huge opportunities because you don't have to go and see somebody local. You don't have to go and infect other people while you're sitting in the waiting room. You don't have to make appointments at a time that the practice is open, because telehealth can be open anywhere and around the country. So even in a different time zone, I think it's going to open up other opportunities like that.
And I imagine it wouldn't be possible as well without things like the technology we have, Apple Watches, Fitbits, other ways that perhaps a doctor can monitor you remotely.
Yeah, and that's the other side of it as well, Jenny. You're exactly right, because there's been a growth in personal monitoring for your own fitness. But now there's no reason why the health system can't tap into that as well. And I know medical devices like that, like our personal devices like the Apple Watch and the Fitbit, but also there are medical devices like pacemakers, which have automatic monitoring built in, and other medical devices which now allow patients to be continuously sending data to be monitored for their own benefit.
Really interesting stuff. Thank you so much for joining me this morning, Gihan Perera.
You're welcome. Great to speak with you, Jenny.